Hi, thank you so much for joining this session about our campaigning work. My name's Laura and I head up the campaigns team at Parkinson's UK. Um, just to say that in this session, what we'll be covering is what campaigning is, what campaign volunteers at Parkinson's UK do, and you'll actually hear from some campaigners about the activities that they've been taking part in. How you can get involved as well is something that we'll cover today. And this slide just really shows volunteers at the party conferences that we go to, meeting in Parliament and at different government departments. And what the slide shows is people from the Parkinson's community speaking out and putting Parkinson's on the government agenda, which is obviously one of the key things that's important to do if we want to create change. So briefly, campaigning really is pushing for change. It comes in many forms, and it's not achieved just by waving banners or meeting with MPs, or even chaining ourselves to railings, as I think some people have said in the past that that's what they think campaigning is. It really involves gathering evidence and gathering stories from the Parkinson's community, and then using that evidence, using those stories and speaking to either different health bodies or councils or decision makers, so MPs across the whole of the UK, or members of the Scottish Parliament, or members of the Senate if you're in Wales, or members of the Legislative Assembly if you're in Northern Ireland. And it's speaking to them and sharing your experience, and you can also do that with the press as well, or in our case, we also work with other charities and other organisations too, like the MS Society or the Movers and Shakers. And it's really about how we can use the data, use the evidence that we've got, use the experiences to convince decision makers that we need more resources, or we need resources in a slightly different way. And what we'll have in just a few moments is a couple of campaigners sharing how they've been involved in the work that we do at Parkinson's UK. Broadly speaking, we have two kinds of volunteer roles for campaigning at Parkinson's UK. The first is very much around events and activities. So, attending a briefing or a meeting in Parliament. So, for instance, World Parkinson's Day is a really great opportunity for us to raise awareness of the condition with parliamentarians. And each year we have a briefing in Parliament where we have people with Parkinson's, care partners who come down, share their experience of living with the condition, how they've been able to continue working or get the healthcare that they need, or maybe not get the healthcare services that they need, and what can MPs do to help with that. We're just finishing up the party conference season this year, and we've had people with Parkinson's and care partners at the Liberal Democrat, Labour and Conservative conferences, and they've been sharing their experiences of being able to access healthcare services, or actually having trouble not getting the right benefits and support that they need. So it's a really great opportunity to share your experiences, to create change, and to inspire MPs to take action and support the work that we do in Parliament. The other role that we've got is really local campaign volunteers. So volunteers who see that there's an issue in their area with a service, and they use their the stories from the Parkinson's community. They use their passion, they use their networks maybe in their local area to improve the service or increase the nurse provision that we have in the area, working alongside other members of the Parkinson's community, MPs, and also the local campaign staff that we've got right across the whole of the UK. So some of those successful campaigns have happened in East Lancashire, North Cumbria, Plymouth, Calderdale, Huddersfield. So we've got lots of experience of people, campaigning successfully for improvements to healthcare services across the UK. And we also have lots of experience of improving how medication is given on time in hospitals, one of the key campaigns for Parkinson's UK. And we have experience of Terry in Barnsley, in Basildon, in Colchester, in Chelsea and Westminster, where campaigners have worked alongside healthcare professionals to improve the policies and the practices that mean that people with Parkinson's get their medication on time in hospital when they go in as an inpatient. And another area that we work on is around blue badges. So a badge that can help you to park closer to shops, and healthcare services. And we've had some great victories in Norfolk, but also Hertfordshire, Stafford, York and Devon, where again volunteers work really closely with the local councils. We do have a whole variety of other things that we campaign on, but really our campaigns are focused by the Parkinson's community and based on what the Parkinson's community want or need. So it could be around things like bus routes or transport, improving the quality of roads or pavements, and also maybe actually increasing the awareness of Parkinson's, so that when people go to the theatre or in shops, they get better kind of treatment because people understand the condition better. So that's some of the work that volunteers do. But now I'm going to pass on to Rob, who will share some of the experiences that campaigners get involved in. So, Rob.
Thank you, Laura. Hello, my name is Rob. I am a senior local campaigns officer here at Parkinson's UK, and I cover the Southwest. However, today it's my absolute privilege to be talking to 3 of our wonderful campaigns volunteers who have kindly offered to give up some more of their time to talk to us about their role as campaigners. They are Viv, Chris and Barry. Thank you so much for talking to us today. Okay, so I'm going to ask you a question, and we'll start with Viv first, please. So, Viv, what brought you to campaigning here at Parkinson's UK?
Okay, well, we started up a young onset group almost 4 years ago now, and it was as that more and more people came to the group, we began to realise what the people's needs were and when they're not being met. You know, the care in the area is awful, and I contact the MP and see if he'll come along to one of our groups. And unfortunately, he stepped down just as we were about to do that. But then his successor was Kieran Mullen, and he has been amazing. He's come along to our group, and as a result of that, he joined the all-party parliamentary group for Parkinson's. He is himself trying to schedule a debate in Parliament on Parkinson's now. So we've had so much help from him, and it's been fantastic. So yeah, that's sort of what led me to campaigning. It was recognising that people really do need help. The experiences that people are having newly diagnosed and given no support, that's obviously an ongoing problem, which I'm trying to help with as well. But yeah, it was just the needs of everybody in the group really, and that seemed to be the way forward to try and help.
Thank you, Viv. That was really interesting. So you're just inspired and impassioned to make change in your local area, which therefore in turn makes change nationally as well. Thank you. Okay, Chris, how did you get in? What brought you to campaigning at Parkinson's UK?
So the major reason why I got involved was in 2008. My wife had retired as a solicitor, and she then was diagnosed with Parkinson's then. And we then initially sort of looked at Parkinson's UK and discovered really that it wasn't exactly what we were looking for. So we got involved with a gentleman called Bryn Williams, who was diagnosed age 38. And Bryn set up two Parkinson's charities, one called Wobbly Williams, the other called Funding Euro. And Bryn then wanted to raise lots of money, basically to set these two charities up. And he was involved in the GDNF trial, which obviously was a trial of a new drug which hopefully could cure Parkinson's, but had to be delivered to the brain by a special operation. So we set out on a whole range of sponsored walks in order to raise funds for this event. So the first we did was the Glens of Antrim and Giants Causeway, that's 80 miles. Then we did the Dales Way, another 80 miles. We then did Hadrian's Wall. We then did the Great Glen Way. We then did the coastline of the Isle of Man, the Fife Coastal Path. But the big one that we did was in 2012, when Gavin Hastings led a group of people. Gavin's wife, Gavin was the captain of the British Lions. His wife has Parkinson's. And Gavin led a team of Parkinson's patients and supporters to climb Kilimanjaro in Africa. So that's a 20,000-foot mountain in Africa, and most people were successful on there, and they raised more than £100,000 for the GDNF trial. And that then obviously went ahead and was featured in a documentary in about 2018, which won the documentary award with the BBC. So we were involved in that particularly. But then that's really the non-PUK side of things. We got involved then in our local Parkinson's UK group when we set up Parkinson's Choir. Myself and my wife, that's been going now for 7 or 8 years, and typically 20 people or so meet every week in that choir for both exercise and singing and for fellowship as well. And that's been going very, very well. That there are main things there, but also recently we've been involved with a big campaign against paraquat. Now, I'm not sure whether you're aware that, again, there's a book called Ending Parkinson's Disease, and this was published, led by Bastian Bloom, the key neurologist in Europe, and Ray Dorsey in the States. And they've effectively said that paraquat is one of the major causes of Parkinson's. It's banned in the UK and it's banned in Europe, but it's widely used in America. Remarkably, it's the company that owns it is a company called Syngenta. Syngenta used to be ICI. It's now Syngenta, which is part of Sinochem, and Sinochem is owned, would you believe, by the Chinese government. Remarkably, there are two places in Europe where Syngenta is, where paraquat is made. One is in Italy, the other is in my hometown of Huddersfield. So obviously they produce much of the paraquat for the world, and that's exported mainly to America. And in 2014, they had an accident on the site where 3,500 litres was spilled on the site, and that's enough to kill 700,000 people. Remarkable. So unfortunately, the paraquat didn't get into the atmosphere. It was contained on the site, but the company would fine £200,000 for that. So myself and David Dexter, our head of research at Parkinson's UK, challenged Syngenta as to whether they should still be producing paraquat in the UK in Huddersfield. We went to see them at the research centre down in Bracknell and challenged their senior scientists. We were able to show them that there is a link between Parkinson's and paraquat, but they said that they are still legally entitled to produce it, that they wouldn't stop producing paraquat itself. So I asked if I could then go and see the site in Huddersfield, which they allowed me to do. I toured that in November, and now the site is very, very safe and has a good safety record. We also monitored around Huddersfield to see if there's any increase in Parkinson's due to the site, and it doesn't look as though there is. So effectively, I submitted the report, obviously, to Parkinson's UK. We decided not to focus much of our activity on that anymore because the chance of a few people persuading the Chinese government to stop production is pretty remote. So we then started on looking at other things to do and got involved with basically the movers and shakers in November. We saw them in January, and they asked them they were going to relaunch the Parkinson's Charter in Downing Street. We said, it's all well and good you're doing that in London. Why can't we do something up north? So we decided to then run a parallel event in the north. My wife Liz persuaded 7 choirs across Yorkshire to come together on World Parkinson's Day, and we got 160 people together there. We got support from our local MP, Paul Davis, and we then challenged the CEO of our local hospital to come. He refused to meet me, but at least he sent his medical director and a member of the Integrated Care Board. We sang Parkinson's songs. We got Bibby Heel to come and join us, and we got Mark Mardell, the BBC correspondent, former correspondent from America, to lead the actual event. It was featured in the local press, local radio. We appeared on BBC Breakfast and also on Look North. We made a significant change, and obviously people then began to take notice for us. We presented the Parkinson's Charter and also a local petition to our local hospital, and they have now agreed that they will increase the provision of appointments for Parkinson's patients by recruiting a new neurologist at our local trust. So we're beginning to make some progress.
Gosh, Chris, thank you for sharing your personal experiences there in all your different capacities and supporting those living with Parkinson's. And wow, I remember seeing reports and watching on TV the choir, and it just shows that singing can change the world. So thank you. And over to Barry. How did you get involved, Barry?
That's been quite a while ago. When I was first diagnosed with Parkinson's over 20 years ago, the first medication that I was placed on was a dopamine agonist. And as people know, dopamine agonists can do very good things for people, but they can also ruin lives. And 2 years of my life were subject to the worst outcomes of dopamine agonists. And but for the fact that I have a very dedicated and loyal wife and 2 absolutely brilliant kids, I'm not sure what would have happened. When I eventually got me back, I looked around and nobody was talking about this, because agonists can lead people into doing things which they would be embarrassed about normally. And so my family and I sat down and we agreed that I should tell my story. And the important thing was the family made that decision. So I approached a local fundraiser, and she started to send me out to Parkinson's clubs. And the first one I was sent to was in Coventry, and I told people about my experiences, and there happened to be a lady there by the name of Claire Bale, who is a prominent member of our research department, and she felt that the story needed to be heard widely. And so I was invited to London, and I made what was then called a story of my experiences, which was added to Parkinson's own National Archive. And from there it sort of went on and on. With the latest campaign that I have worked on and featured in being time critical medication. It's, as everybody who has Parkinson's knows, it's absolutely critical that you get your meds on time, particularly if you're in hospital, because not getting your meds on time not only causes you increased anxiety, symptoms, tremor, whatever, it can ultimately destroy your use of that particular medicine. And it was getting that medicine, that message over to people in the health service, people in political service of the House of Commons, just key professionals and people in the Parkinson's community, so that they felt that they were on firm territory if they were arguing their case with anyone. I think the progress is there. It's doing well, and when I attended a recent parliamentary lobby on this subject, somebody came up to me and said, "Oh, you're time critical, Barry." Now that is a name I'm perfectly willing to go with. And over the years, I've been involved in many campaigns with some of the most dedicated people I think I've ever met. The other important one I'll just mention is mental health. And that has also been a privilege and a joy to work on. And I help out on the English mental health focus group and the Scottish mental health focus group. So, yeah, I think there's still plenty to do, and there's always plenty of room for more people to join in.
Thank you very much, time critical Barry. I will save you as that from now on, and you are indeed. So thank you so much, and from sharing your personal story, and the power of a personal story takes us a long way. So thank you. Okay, I'm going to go back to Viv now. And Viv, please could you let us know any particular campaigns you've been involved in and how did they play out?
Well, it's strange actually that Barry was just talking about that, because I had a bad fall recently, and I was taken to A&E in my local hospital. I said to everybody that I had Parkinson's, and none of the healthcare professionals actually said to me, "When do you need your next medication?" It was quite an awful experience, and my friend actually came to my rescue in the end. But I've now got an appointment to see the deputy chief nurse at the hospital on Wednesday. I'm going to take any information I can find about the time critical meds, because it is so important. You know, they thought I might have fractured my neck, and my tremor was horrendous. So, you know, they should have given me my medication, and then I'd have been, a lot calmer. But anyway, that was that one. The Parky Charter has been probably one of the main things that our group has been involved in. Linda Clark is also a campaigner, and she's done an amazing job with that too, to try and get the 100,000 signatures for the petition. And we've done all sorts of things, like we've walked along the seafront trying to get signatures. We met some other people in Brighton, and unfortunately it was a really rainy day, but we still managed to get some more signatures that day. And Linda, in actual fact, was at the Hastings Pirate Day dressed as a pirate. And she did really well. She got a lot of signatures from Hastings that day. So there's been a lot. Our local group, they've all been helping. We've asked them, to sign the petition and get their family and friends, and it's been a great success. And I'm really proud to say that our constituency actually came top in the country for the number of signatures for the Parky Charter. So that was fantastic, and also it encourages our local MP too. We had a meeting with him afterwards, and he was really delighted that his constituency was top in the country. But it's just so important, and hopefully we'll get this debate. The thing that we're trying to get across now is trying to get all the Parkinson's groups to actually contact their MPs to engage with them and understand Parkinson's, so that when they have these debates that are coming up, that they really know how to help us. That's crucial. And thank heavens for the movers and shakers for actually putting the Parky Charter together. And on the back of that as well, Paul Mayhew Archer, he came to do a show for us in Hastings just recently. And we raised £2,300, which is going to the nurse appeal, Parkinson's nurse appeal, because we obviously know, the situation is very difficult for everyone, as in, trying to get to see a Parkinson's nurse, get diagnosed in the first place. The lack of neurologists. It is. I can't impress enough how we really do need help with that. There's so many people that aren't being seen and aren't getting the help they need, and especially the people that can't get to the hospitals. They're at home, and who's helping them? So there's a lot, as you said, Barry, there's still a lot to do. But we've got to just keep going and not get knocked back if if something isn't going quite right. Just take the wins, even however small they are. It's just being passionate enough to keep going. We've got a great local support group, and I'm very, very grateful for their backing as well. They've all been fantastic. Newly diagnosed as well, that's on my agenda. I've been trying to work with the local hospital to try and get new packs handed out. Parkinson's Connect has at last been installed in the hospitals in our area, which is amazing, because at point of diagnosis, people will then get referred to Parkinson's UK, and the support there is incredible. But they just need to be made aware. There's so many people that have come to our group that have said, I was diagnosed and I left the room with nothing. And it's devastating. It's so lonely, and it's so simple to change that. So that's something else that we've been involved in. One of the things actually that was amazing, I was on a call with Jack Grant. This was after the announcement that they were going to review the PIP again. It wasn't going to go through as they planned, and I've never seen him so excited. It was actually really nice. And he said it was because of the personal stories that people had written into their MPs, and that had such an influence, such an impact on the government's decision. And that is fantastic, that we are actually making a difference. It's it really does encourage and inspire people to do more. It's not easy to share your personal story by any means, but if you can have the courage to do it, it's so worthwhile, and people are listening, and that is what is so crucial.
Thank you, Viv.
That's it, I think.
That was fantastic. So good luck with the meeting on Wednesday.
Thank you.
And I hope you're not dressing up as a pirate. But good luck, and fantastic at all. So really range of experiences. So thank you so much. Chris, please could you tell us, provide us with an example of your campaigning and how it played out, please? Thank you.
Very good. So obviously there are probably three key areas that we were involved in. One obviously was fundraising for clinical trials. And we were inspired initially by a book by Tom Isaacs called Shake Well Before Use. Tom is one of the legends of Parkinson's. He's a hero. He set up the Cure Parkinson's Trust. He inspired us. He walked around the coastline of the UK, 4,600 miles in a year. So our long distance walks were inspired by Tom. And obviously, we raised funds for the GDNF trial, which obviously went ahead. and it wasn't quite as successful as we thought, but that was a really inspirational trial. The other thing obviously was then in the paraquat campaign that we had, which I've mentioned, but the main thing really where we've made some progress is our local campaign, which really was to make the health authority aware. In our health authority, we don't even have a neurologist. We have a neurologist who comes from Leeds, and he spends 5 hours a week looking after 700 Parkinson's patients in the area. So the chance of seeing a neurologist is maybe once every 3 years. My wife has seen a neurologist on the NHS once in 5 years, our secretary once in 7 years. It's simply not acceptable. So we contacted the leader of the trust, a gentleman called Brendan Brown, and I said, could I discuss the issue with him? He said, no, he wouldn't meet me. He refused to meet me. So we then obviously got involved with the movers and shakers, and clearly they were relaunching the charter in Downing Street, and we wanted to do a similar event in Huddersfield. So we got these 7 choirs together to sing on World Parkinson's Day. And because we were able to get Mark Mardell on board, we got the BBC there with us as well, local press, local radio, and also an opera singer called Bibby Heel. We made a big event of this. We were able to relaunch the Parkinson's Charter to local politicians. The key person there was Paul Davis, our local MP for Colne Valley. Paul is remarkable. He came and spent a morning with us and took Parkinson's campaign on his shoulders. He then, in May, led a debate in Parliament for the cure, basically looking for treatment for Parkinson's patients. And he even mentioned our activity in Hansard. We're mentioned in Hansard for the work that we did in Huddersfield. And we then presented to Paul and to the medical director of the hospital a petition requesting for greater number of appointments for Parkinson's patients in the Huddersfield area. As a result of that, I met with the operations director for the hospital, and we've drawn up a plan to increase the face-to-face contacts for Parkinson's patients. In August, 2 new neurology doctors started, coming from Leeds to start in Huddersfield. One of them's the registrar working with the existing consultant, and they are now also in the process of recruiting a full-time neurologist based from Leeds, but to spend 80% of his time in Huddersfield. That takes place in December. So basically, with all the pressure we put on the local authority and the senior managers, they're beginning to listen to us. We're making some changes there for our local Parkinson's patients. We're beginning to get things done.
That's absolutely outstanding, and it just shows the power of people and the combination of a number of different tactics, from media to singing to the public, people in the public. That's absolutely fantastic. Thank you, Chris. And I've been blown away by that story every time I hear it. So thank you.
Good, thank you.
And Barry, please, can you just one particular example of your many campaigns and how it played out, please, Barry? Thank you. Oh, just take you off. Could you take yourself off mute before you start extolling us with one of your stories? Thank you.
Sorry about that. I think one of the things that I've enjoyed being part of, one of the many things, is World Parkinson's Day, because we reach so many people through that one day. It's a shame it's only one day in the year, but it is a time for the Parkinson's community to stand up, to shine, and to be taken notice of by a world that sometimes doesn't take notice. But because everybody is joining in with that, it has such a dramatic effect, and it helps us then refer back to and highlight the difficulties that people face in their everyday life. And I was super proud to be involved in this year's World Parkinson's Day planning, and my daughter was involved because she took the photographs of the guys who took part in World Parkinson's Day. And so very proud dad, and a very proud member of the World Parkinson's Day group. The individual stories and those people's journeys will have impacted on a lot of people's lives. And yeah, I'm happy to have been part of that.
Thank you, Barry, and thank you for raising a key date in everyone's diary, World Parkinson's Day, an annual day where we speak about Parkinson's across the country and raise it in the national presence as well. So thank you so much. Okay, before we wrap up, I'm going to ask you to provide one of your top tips, please, of campaigning. So if I could see the slide for top tips, please. And I'll ask you one by one, what would be your top tip to share with people who about campaigning? So Viv?
Are we looking at the slide?
Or whatever you prefer.
Oh, okay, that's fine. My top one would be probably remain positive. Remain positive. Don't get discouraged if you're not back. Just keep passionate, keep your commitment going, push forward with the campaign. It's so important. I mean, we do have such great support from Parkinson's UK as well. I must just say that they are always there whenever we've needed to ask them anything or any help with anything. So thank you so much for that. I didn't say that in my previous bit, sorry. But yeah, just keep going.
Thank you, and thank you for saying that. Chris, what would your top tip to be?
I think basically focus your attention on those people who can make a difference. So as they obviously, from our perspective, we got our local MP on board. We then put pressure on the senior managers in the hospital because they're the ones who can actually sort of improve things from a consultant point of view and from a hospital stay point of view as well. We also got the local mayor involved, local councillors, and obviously spoke to local consultants. And also then we even contacted members of the integrated care board, that the government board, the management board who looks after each individual sort of region. And so it's focusing on those people who can physically actually make a change and target your activity on them, because those are the ones who can actually deliver the things that we really are aiming for.
Thank you, Chris. That's really important. Yeah, know who you're working towards, and identify those individuals who can make the change. Thank you, Chris. And Barry, what would your top tip be?
I think that humour and honesty can be very, very effective tools if used appropriately. And it's being honest about your experiences, your lives, and even when some of the most tragic things have made you laugh. Because if we forget to laugh, we forget to engage with life. And we might have Parkinson's, but we still have lives. And for the most part, I still have got a pretty good sense of humour.
Thank you, Barry. Thank you very much. And thank you to all three of you, to Viv, Chris and Barry. Thank you so much for sharing your inspiring experiences and insights and stories with us. And we look forward to seeing what you get up to next. And hand back over to Laura. Thank you.
Brilliant. Yeah, thank you again, Viv, Chris and Barry, and to Rob for acting like our own Graham Norton in terms of that panel discussion. Really what I just want to do is to finish up by saying you can get involved in local campaigning by speaking to your local campaigns team. You've got the names of the members of staff in England. In Scotland, if you speak to either Tanith Muller or Mari Gordon. In Wales, either Rachel Williams or Sarah Bowditch. And in Northern Ireland, either Sarah McCulley Russell or Nikita Ferguson, and you'll be able to find out more about how you can get involved. The other thing to say is that we do have regular calls where we connect people with Parkinson's who are part of the community and volunteer in terms of campaigning. So again, don't hesitate to give us a call on the telephone number there, 0207 963 9349, or email campaigns@parkinsons.org.uk, and we can put you in touch with the person in your local area who can get you involved in campaigning. But once again, thank you so much to the volunteers today, and thank you to everybody for tuning into this session, and I look forward to seeing you at a future meeting of our campaign volunteers. Thank you.